Live to be well. Live to be well with Dr. Kim, with Dr. Kim.
Good evening and welcome to Live to Be Well. I'm Dr. Kim Logan-Nowlin, your host all the way from Detroit, Michigan. What is Live to Be Well? Well, mind, body, and soul being connected and mental health. Being a mental health specialist for over 40 years now, providing services to families, to children, to couples, to individuals, to people who are looking to be healed. We're all looking to be healed and find an understanding. I pray that your week has been good thus far, and I'm just excited about today. Do you know that this month is Autism Month? We are here today to talk about autism. And a lot of times we tend to overlook the meaning and the understanding of autism. How much time do we spend studying and really following the lives of people dealing with autistic children? Well, we tend to say we don't have that problem until we have that problem. Well, tonight we have a very special guest who doesn't look at it as a problem, but as a blessing. And I want to just share with you the definition of autism and give you some statistics if we can do that. Because it's very important that we understand autism or autism spectrum disorder, ASD, refers to a broad range of conditions characterized by challenges with social skills, repetitive behavior, speech, and nonverbal communication. Nonverbal communication. So let's look at the statistics. According to the Center for Disease Control, autism affects an estimated of 1 in 36 children and 1 in 45 adults in the United States today. That is a large number when we start talking about the care of children and even adult children. So we're going to look at the myths. We're going to look at the understanding of autism. We're going to talk to someone who is actually dealing with this every day. I want to bring my co-host in, ML6. Come on in. As always, it's a blessing to see my beautiful daughter. We had a wonderful time in Huntsville, Alabama last weekend, and it was so good to see her there. How are you, ML6?
I'm well. How are you?
I am good. We have been going to concerts and been on airplanes, and we just been doing some of everything. I have to say that I really enjoyed the Hallelujah tour, and my daughter Micha made sure I got a chance to meet the one and only Jonathan McReynolds. And I love my song Able. That's one of my favorite songs. And I want to say publicly thank you, Micha, for always making sure that mommy has a wonderful time, and I get to go backstage. So thank God for your kindness and your relationships that become my relationships. And I pray that I will always make you proud as you have made me proud. So, Micha, we're going to talk about autism, and when we started talking about this, you came back to me and said, Mommy, this is Autism Month. Also, it's Substance Abuse Month also. So, and then you said you had a dear friend who also had an autistic child. So I would like for you to bring in our special guest, and I would like for us to get into this topic so that we can bring wisdom and knowledge to our viewers.
Okay, good evening, everyone, once again. So today's show, very special guest, one of my dearest friends. I am really blessed to have amazing friends in all different avenues of life. And this one right here is, I call her like my seeker, my wisdom. If I have any question about life, from life to the streets, she gets me all the way together. But a few years ago, when we found out that she was having a baby, of course we were excited and all the things. And then as time went on, we made a discovery. Well, she made a discovery and shared it with us. And coming to our platform is my dear friend, Danielle. Smitherman, aka Danielle LaVon. She is an author, she is a publisher, she's an educator. More importantly, she is an amazing mother. Danielle, welcome to the show.
Hello, how are you?
I'm good.
Welcome, Danielle.
Um, so let's just start from the very beginning. Before our Aiden was in the world, were you even familiar with autism?
Yes, I
Okay.
was. So, as an educator, I knew about autism. Now, I was not in special education, but I have taught students with special needs. So, I taught general ed, but sometimes special needs students are in a gen ed classroom. And so I have worked in what we call inclusion class. So those students are in my class with a special ed teacher. And so we work together. So I have had students who were on those traits, but they weren't, as we call, on my caseload. So I didn't work. So I knew their traits. I knew like their needs and some of the things that I had to do with them. But the special education teacher in the class really worked with them more closely than I did, if that makes sense. So I
Mhm.
did. I've worked with students who had special needs. So there were, I guess, traits and things that I was aware of and I've seen just working in the education system. So I was aware of it. And of course, just in life, you meet people with autism and you see things like on TV, just in media and things. But I don't know if I would say that I knew anyone like close to me, I would say, or not that I had diagnosed myself. Like now, I think I diagnosed everybody a little bit, but 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 I don't think I there was no one close to me before. Yeah.
So when Aiden got here, he was, I mean, I remember him and the elephant. Remember he had the elephant bundle thing. You gotta remember. I was just looking at his baby the other day. And when did you start to notice that something was different or special about Aiden?
mm, During the pandemic, I think that um, well, it was really, I would say, around one. Of course, I'm an educator, so there were things I was doing, and I was teaching him his numbers and teaching him letters. And at one, he was reciting his alphabets, and he was doing all of these things, and like he was just counting, and everything. It was just like repetitive. He would do it over and over and over. Like he, we would have like the posters on the wall, and he would say the colors, and he would say all of his numbers and shapes. I mean, he would say things like octagon and like and those were things that I was like, oh, okay, I'm thinking he's smart, like, oh, I'm a good teacher, and then but as time progressed, there were things that I just kind of noticed, but just to be honest, it was kind of I noticed, but I was in denial a little. Like I noticed it and I was like, oh, it'll pass, or he's so young, and so there were just things that he wasn't doing, like he never said mommy, like he never, he would repeat numbers and letters and colors, but he wouldn't do normal things like when kids ask for juice or they'll ask for a block. So it was certain things like that or he would go in circles and he would do things what we call stimming things with his hands all of the time. So we would notice those things. And so but I kind of ignored it, I guess, for a while. So I
And
guess
so
between the
that's
ages of one
interesting,
and two.
1 and 2. And it's interesting that you said that you were kind of in denial because, and we've talked about this, my best friend, her son is autistic. And it's that denial piece that I find to be a common denominator. Even when I hear stories of other people who have children, it's like at first they just don't want to accept the fact. So when did you say, okay, this is what's happening. I'm recognizing some things. When did you come out of your denial And how immediate did you go into, all right, I got to figure out what's best educationally and in my household for Aiden?
So we were, because I was an educator, we were home for a school year, a little over a school year. So once we went back and he went into daycare, and there were things that he just wasn't doing with the other kids, and there were just things he wasn't socializing with kids. He wasn't playing with them, and he was not talking. So the speech, the daycare that he was in, you helped me find the daycare, and the daycare, the daycare that he was at, they actually brought in a speech therapist, and the speech therapist, she really worked with me, and she kind of suggested it. My mom at the time was working in a clinic, and they worked with patients. It was a clinic for autism, where those patients were a little bit, I guess, higher on the spectrum, or so say, and they had seizures and things like that. So my mom noticed things. She got him an appointment. So this was around 3, and he was diagnosed level 2 ASD. At the time, he was what we call nonverbal at 3. So he wasn't talking. His social skills were really low. Like, he would not communicate. But the weird thing was, me and him had our own communication, because we were in the house. So we knew, and it was like, he didn't talk to me, but he talked to me, if that makes sense. So I knew what he wanted, but he wasn't verbal. But he wasn't verbal with me.
My boy.
So precious.
Thank you. So yeah, 3 is when I decided, or I knew. And even then, after the diagnosis, I think I was still in denial, because I didn't want him labeled, because I worked in education and I've seen Black boys labeled, and I just did not want him labeled. So I did have a hard time with the labeling. So it took a minute, even after the diagnosis, for me to just kind of accept.
But I can say, though, when you did, you were like on it.
Yeah.
You were making sure you were on it. If you were, and for those of us that were your friends that were close to you, it made us more aware too. And it helped us understand a little better. But I remember, for me, when I realized how special he was, I came in Atlanta, it was a little bit after the pandemic, and he had his iPad. And it was so amusing to me. And I make jokes about it now, but everything was in Arabic.
Oh yeah.
Everything was in Arabic, Mom. Like, and he understood it.
Wow.
He understood it. Like, and at that time, if Danielle tried to change it back, he would change it back to Arabic. So whatever was on the iPad, it was in Arabic, and he understood it. And he was back there talking in Arabic. I felt like he was kind of cussing us out in Arabic. He was in Arabic. And I was like, yo, like, he's really smart. And I think oftentimes when people think of autistic children, they say the word special. No, they really are special, because the way they think and the way that they process and the way that they see things, it's on a completely different level, which will make you think like, wait, I might be the dumb one. Like,
yeah, he when he goes to the iPad, he purposely puts it in different languages, and then he knows the language, like, because he watches it over and over, so he knows what they're saying, and then he's like repeating it. So he'll watch it in Spanish, and he'll watch it. It's so Sesame Street, they have all the different languages. So it's like Shalom Sesame Street and Hola Sesame Street, and he just turns it to all the different ones, and he just watches it, and he counts in whatever one he's deciding to watch that day.
How old was Aiden when he said his first word?
He was 1 when he
He was one
started.
of them.
Yeah, or
First word.
a little before 1 when he started talking. Well, identifying things. So he's an identifier. Like he can identify things, but he doesn't hold. Well, recently he has started talking, like holding conversations and telling you things. But before it's just like he identify things, like he knows
And
what
when you
things are.
and when you said level 2, you said ASD level 2.
Right.
How many different levels
Good question.
are on the autistic spectrum that you know of?
3. So
It's
they
3.
either they level it. They say level 1, 2, and 3, but they call it the spectrum because even if you're level 2, there's a spectrum of level 2. And so it's like a rainbow. It's like a spectrum. So even when even Aiden can be level 2 and someone else can be level 2, but they won't be the same. They'll have some of the same characteristics, but they won't be the same. It's just kind of to help identify um like how I think the level of social skills that they're in. So level 3 would be those who need like are more severe. You'll see those who are maybe like in wheelchairs and need the assistance with the pads and things like that. That's like level 3. That's the highest. And then level 1 is, what they consider like Asperger's. They're more functional,
Oh,
but sometimes they don't understand that they even have something wrong with them.
okay.
I won't say
And
something wrong
so,
with them. There's
Right.
nothing wrong with them, but there's something different about them.
Mhm.
and when did you realize that you had a different level of patience?
um, I think I think your children teach you. You're supposed to be teaching your child, but I think the child raises you and makes you a different person. And I just think that the Lord just knows what to give you. And so I know that it's kind of me and Aiden, we just kind of go together, if that
I
makes
know.
sense.
Yeah.
It's like we just work. It's like we're actually a lot alike sometimes that I, kind of wonder. But so so I don't know if it's a level of I would say it is patience, and I have had to learn things. And I think I told you this. It's like he teaches me to slow down. There are things that he does or
Mm,
things that he notices
mm,
that you don't notice.
mm.
So if the wind is blowing, and I'm a woman, so if the wind is blowing, I'm like my hair, and I'm trying to get out, but he'll stand and he'll
Mm.
just let the wind blow. He just wants the wind to blow. Or like when it's raining and you're trying to get out of the rain, you don't want to be wet, but he's like he loves it. He just wants to stand and play in the rain. And it's just like weird things. If he sees leaves, he has to pick them up and throw them, and he has to look at the leaves, and everything is like things that you don't notice or that you'll just pass by because we're in the rush of life. We're just trying to get there.
Right,
He
right.
stops and notices it. And it makes you stop and notice, little things. So
Mhm.
I think he has taught me patience. I don't
Patience.
know.
Wow.
Mhm.
Wow. Well, let's go to our question. This is wonderful, Danielle. And we want to say to all our viewers, please, you can still take the time to ask Danielle a question. If you are experiencing this and you want to just have a support or maybe find a support group for you, what does patience with children look like for you? And I have to tell you, Danielle, I am a special needs child. I was diagnosed in the 6th grade with learning disability, and I was a severe stutterer, and I had speech therapy for over 20 years. So it was very, very challenging for my parents, especially my mother, having 3, children who were on the spectrum of normality. And then here I come with these disabilities. but my mother, such as you, she really poured into me. Well, what does patience with children look like for you? And my mother had a lot of patience with me. It took a lot of patience with a special needs child. All right, what's our first comment? Having a calm head. That's it, Thomas. You've got to be calm in your approach and how you are going to navigate with a child and having patience in our everyday lives. Tanya, listening to understand and not be patient with who's right. Even if they are wrong, they still deserve to have the feelings acknowledged. Lastly, not press my beliefs, desires, and unfulfilled dreams on them. I'm guilty of this and more. I appreciate your transparency, Tanya. Debbie Rapp, bend the knees to the Father. A lot of prayer, a lot of prayer. All right. Rosalind Moore, speaking calm and nurturing, giving time for them to make mistakes and to have the patience to correct them with love and an explanation of their unacceptable behaviors and the acceptable behaviors we would like. Things change from age groups. This is just a little, I believe, shows patience. Mother of seven, a mother of seven. My. All right. Knowing it takes a village and to respect the village, Lord knows Jesus has to be in the mix. Amen, Rosalind. Catherine Clark Malone, training them in the way they should go patiently. I'm so glad I am a mom. She loves being a mom. Amen, Catherine. We want to thank everyone for their comments, and we appreciate your comments. So when we start talking about some of the things, how do you discipline Aiden? What do you do to correct his behavior?
Okay. um, well, it's a little different with Aiden. When he sometimes, well, children on the spectrum, they're used to routines. So when things don't go as normal or things change, there are times that, he will have like he'll have fits or tantrums, or he'll fall out. A lot of times I don't, with my first child, she got spankings. I don't necessarily, spank him. There are times that, I have to sit him, hold him.
Okay.
There's redirecting. We do, we have to do breathing. If he has like the tantrums, we do Elmo. He's into Sesame Street. He's obsessed with Elmo. And so we do Sesame Street. So Elmo has a thing where he belly breathes and we breathe in and out, take our time to just kind of um, take a break. I do give him time out, sit down, and he has to sit and
Okay.
figure those things out. The same things as you do with other kids. Take things away, take the iPad, take the tablet, and see, the things that he wants, or sit him down. I'll turn the TV off. The same things that you do with other kids. But sometimes it's the understanding of what he's done. Sometimes just to make sure that he understands. But most of the time, he knows exactly what he did. He thinks it's a joke. He laughs. He'll do things, laugh and run, and then you have to get him and come back and explain what we don't do, and then kind of sit him down and make him understand it. So
How was his sleeping patterns, eating patterns? How are they with Aiden? Let's talk about that.
okay, so in the beginning, the sleeping, he did not sleep, and so his neurologist, the one who diagnosed him, I had to sleep train him, and this was around 3. He would wake up in the middle of the night and he would be up all night, and then he would not want to go back to sleep until it was time for me to get up and go to work. So I was exhausted. And so we finally had to do things like really put him on a schedule. So at night at a certain time, like even my TV, everything, the house just kind of went dark. We put on soothing music,
Yes.
and then there is a step-by-step routine, and I still do this to the day. Like 7:15, the alarm goes off, he gets in the bath, we're in the bath, he, lotion, pajamas, bed. Like he has to have that routine, and then he does that because he will not sleep. And he still has nights where he'll wake up in the middle of the night, but it's not as often as it
Okay.
used to be.
Okay.
Um, I do give him melatonin to
Okay.
calm him because he is very active. So from the minute that he wakes up, it's like up, boom, and then it's all night. He doesn't take naps in the
This
day.
thing.
Wait,
Mm-mm,
and he doesn't take naps?
not a nap.
Oh, I didn't know.
He wakes up at 5:30 and he goes to sleep at 8. And then now food, he eats the same thing him and Six eat pretty much just alike. They eat raisin bread and
Okay.
yogurt, and they're just like the same thing. He has a lot of allergies, so
Okay.
it's very repetitious.
Okay. Just like
He
Audrey.
doesn't eat a lot. Hmm
Okay. All right.
So it's the same thing.
We have a question in the chat room. We're gonna bring that in for you, Danielle. Okay. Melissa Martin. What can teachers do to better support special needs children in the classroom? Another educator, Melissa Martin. Danielle, would you address that for her, please?
Um, I would say the one thing for teachers to be able to support your students, it starts with the parents. The parents, you're the advocate. You have to make sure that you advocate for your child. You have to make sure that you get everything. Like I said in the beginning, I didn't want my son labeled, but I had to get over that, and I had to make sure that I went and I actually got that IEP, and I made sure that his teachers knew the accommodations and they knew everything to do for him. Because if you don't do that, then they don't know what to do. So um, making sure that you do get that everything in place. So once you get that IEP, that individual educational plan, then they'll know exactly what to do. So it lays out exactly everything that they're supposed to get, you know, down to what the nurse is supposed to do, what the teachers are supposed to do. Like, and sometimes those meetings are very long, they are very tedious, but if you want your child to get what they're supposed to get in that school, and then if the teacher doesn't do it, you know, you have that paper there. That's the law. That's what they're supposed to do. So that's how they can support. You have to be your child's advocate. You have to make sure that you're there. You have to make sure that you go to the conferences. You have to make sure that you're communicating, that you know your teachers, and that's the only way that the teachers can support. Because if they don't hear from you and they don't know you, you know, they can't support your child.
Danielle, how difficult was it for you to find programs or to find the things that you needed to find? And what's the difference between within our community and the others community in terms of what's available?
If you know me, if you know me. So when my son was diagnosed, and I did opt to put him in ABA therapy. Um, some people are for it, some people are against it, but I did want him in the autism behavior therapy. So I did want him in therapy so that they can help him with some of those social skills. I did seek to find therapists that were of color because I did want them to work with my son. We just know it's just the fact that there's a stigma in the
Yeah.
Black community. When my son was diagnosed, you know, there were people that they was like, "Ain't nothing wrong with that baby." There's nothing wrong with him, but he does need, you know, some assistance. He's gonna need some special services so that he can get what he needs. And so We just have to be sure that we get our children the services that they need. One thing that I think that we don't know is that all children, it's in your insurance, that they can be tested for autism at the age of 3. It is just it's, like you get your 5-year-old checkup, you don't have to pay for it.
Wow.
And then a lot of people of the other, side, they know that. And that's just a routine checkup for them. And we never do that. And so that's just something that we need to start looking at, and it's not anything wrong with the child, it's just something that just a routine, And so if the younger that you find out these things, if you can get your child these services early in the game, and they're more likely to be more successful as they
More
get older.
successful, right?
Because they'll have
and that's why I asked you that, because that's new information to me. I didn't even know that is something that's readily available in your basic insurance, because most people don't even think when they have kids. Like, so now I gotta tell all my new moms, yo, you're just in insurance if you just want to get the test.
It's just a basic. You just, it's there. It's a routine assessment that you just. Now, the one thing that I will say, sometimes it's hard to get in. So I know the doctor that I got in with, he has like a year-long wait list. So sometimes there is a wait list, but it is a routine assessment. So you could go ahead and schedule it. Now, if it takes a while for them to get in, then that's fine. But you can go ahead and have it. And I think that we just need to not see it as a stigma,
right?
It is a little bit hard depending on where you live. Of course, when I was in Alabama, it was hard to find him therapy. Like, I was there for a year and I never got him any of the services that he needed. It was much easier once, like Georgia, the resources, the school district that he's in, he actually receives all of his services within his school district.
Wow. That's wonderful. That is wonderful. We have 3 more comments for you, Danielle. All right, let's bring up the first one. All right, my sister in Florida. Good evening. I'm so glad for this program this evening. I know Miss D has an older daughter and some challenges, so we appreciate you, Miss D. All right. Our next comment. The reason in the classroom. In the classroom. All right, Danielle Brown.
No question.
No question. Just showing some love you, D. All right, Danielle. You love, show some love to mama too. Amen.
So Danielle, I think that now that Aiden is 5, and now that you have, you've gone through the early stage steps, and now we're seeing him like he is a little boy now. Like he has his own personality. He does his own things. It's like now we're seeing him, he has friends at school now. Look, he has friends at school now. As a mom, just in the last 5 years, seeing him like present day, what does it make you feel like just watching him just like today, just seeing him in the tub floating? What does that make you feel like?
It gives me a sense of joy. Like, when your child is kind of diagnosed with something like that, your heart kind of stops, because you're thinking of, first of all, I have a black son. So you're thinking of all the things that your son is going to encounter in life, just being a black man. And then on top of being a black man, now you have diagnosed him with special needs. So I'm like, oh, black son, now he's has special needs. Now, as I see him just like growing and developing, and now he's starting to talk. Like the other day, I told you that he never said mommy, but the other day he was like, mommy, mommy, mommy. And I'm like, it's so, sometimes it's so shocking. And now Now we're in full arguments because like today I'm trying to use the bathroom. He's kicking the door in. I'm like, what you want? He's like, I want my tablet. And I'm like, wait, like, so now we're like having conversations and it's like, okay, so now I got a little boy, like I see him developing and really growing. But I do think that it's all in part of me accepting, that he was different and then making sure that he got the services and that I made sure that if the doctor said that he needed speech therapy, okay, well, he getting speech therapy. If the doctor said he needed 6 hours of ABA therapy, well, he getting 6 hours of ABA therapy. Like whatever he said he needed or whatever they suggested, we're going to try it, at least try it, and see if it works. And the teachers, I'm talking to the teachers. I try to stay active. I always, I'm doing whatever. I'm researching. I'm trying to make sure that I'm in the know. Like I'm reading. I'm trying my best to make sure that everything is going on. And other than that, I mean, we just learning from each other.
I know earlier my mom asked about his eating habits. And I remember at one point he was eating like just like certain things he was only eating. Where is he at now with his eating?
Same. So like everything is pretty routine. Like breakfast is, y'all still eat your raisin bread every morning. So he's raisin bread or waffles. Lunch is chicken fingers and he'll eat fruit. He loves strawberries. And dinner, chicken fingers. He does eat noodles, yellow rice. It's very the same thing. I think a lot of things are texture for him. Certain textures he doesn't want to touch. He's not going to eat condiments. And then we're also very careful because of his allergies. So he does have like dairy. He can't have dairy. He can't have seafood. He's allergic to nuts. So things like that, we have to be very careful to make sure things aren't cross-contaminated and things like that. So, but he's very picky about touching things.
That was Micha. Do you know, Danielle, Micha does not let her food touch.
Touch.
I'm like,
It's just a preference. I just know.
And
a little worse now.
All black girls are like that. They don't like their food to touch. Let's put the peas on the mashed potatoes. Let's do. I'm ready. Let's go. Okay, let's make them out there. We have another question. We got a question for you, Danielle. All right. Vonnie Carroll. Hey, Vonnie. Love this. I'm like, what type of doctor to assess for this?
A neurologist and a psychologist. So there were actually two when I did the assessment. So there was a psychologist there and a pediatric neurologist. And they work together. And he does see the pediatric neurologist every 6 months just for checkups. Even when he has his IEPs for his school, his neurologist will actually sit in on his IEPs.
Yes, that's very good. Yes, that's very good. I do that when I do the IEPs and I go and dealing with that. My husband, this was his area of expertise when he did his clinicals, was autism. He loved working and specializing in autism and substance abuse. And the children just loved him. He was very patient with them. And if one child started to rock or would go and hit their head, he would go and hold that child. We have another question. All right, Brother Rogers. Ashley Williams, what advice would you give to parents who are just starting their journey after an autism diagnosis?
I would say my advice is it's going to be overwhelming. There is a lot of information. So when you get that diagnosis, they're going to give you, it's like you get a manual and you just kind of got to take it day by day and step by step. Just know that you do, I would say, figure out what you think is your child's biggest need at the time. So if you think that your child at the time, like my child, I really want them to getting into speech therapy. Then focus on getting the speech therapy for them. But I would say don't try to overload them. Kind of do one thing at a time, because then remember, autism is sensory. So too much and it can be a sensory overload. And so they'll tell you just put them in everything. But I didn't do that to Aiden. So I made sure that when I first put him in ABA therapy, he got everything in that center. So when he went to ABA therapy, the speech therapist came to him, the physical therapist came to him, and then he got his ABA therapy there. He was comfortable in that space. So everything was there and he was just getting everything there. So try not to overload them with things, but just try to figure out what is the highest need at that point and then just work from there.
Okay,
Just recently, you redid Aiden's room, and
Yeah.
you made it to be like for what his senses could handle. Can you kind of describe that a little bit too for parents, and the importance of having their spaces be conducive to their needs?
Yeah, but he was just tearing his room up. And so like he was just I felt like his room was not inviting for him. So a lot of times we as parents, we kind of pick things that we like and we're not really thinking about like what the kids need or what they want, and because Aiden doesn't talk to me, I was just kind of thinking like what do boys want in their room, but I wasn't thinking about what he needed as far as sensory, for him. And so I started looking up sensory friendly rooms and things that would help him feel relaxed and calm in his room. So it was things like the lights were too bright. I would notice when he comes in rooms, he'll cut the bright lights off. He wants to come in the room and cut off the bright lights. And then most of the time autistic kids like to get in small spaces. And so I got him like a little tent. So he goes in like his little tent and he has like his little bean bag and he goes in there and he has his trampoline so he can jump. And so now when he goes in his room, his lights, he has the low lights, they're blue. And so nothing is bright. And now he just plays in his room. He'll stay in there. He'll close his door. And now he relaxes in his room before when he wouldn't. But I wasn't thinking about his sensory issues. I was just like thinking about a boy's room. And so he has all of those things now. And you can look these things like Google sensory friendly. You can go on Amazon and just type in sensory friendly and a whole list of things will come up.
This is so powerful, Danielle, and I really appreciate the knowledge base, because when you think about it, and before I bring the comments up, we too need that sensory environment, as women, as men. Men have their, men cave, where they go, they can be themselves. And we have special rooms in our homes, our apartments, and a special place. What do you do to get your downtime? What do you do for Danielle for your safe place, your special care and self-care? What does Danielle do and when do you get that?
When do I get that? Let's see. What do I do? I do. My room is kind of, I guess you could say I'm more of on the, what would you describe me? It's like a boho type of person. I have my plants and my candles and, I do dim, like my lights and I'll sit in my room. I read. I will like kind of read. I do my meditations.
Okay.
One thing I will do, I will cut off the lights and I like to play the rain. Like I tell Alexa to just play the rain sounds. I just like to listen to rain.
Okay.
So that's one of my things that I do. And I like to listen to outside noise. So I'll open my door.
Okay.
And I won't have anything. I have a door in my room.
Okay.
And so I just open the door. I just like to listen to outside. I know that's kind of weird, but that's
who watches Aiden for you? Who's your support system?
My mom. My mom is biggest support
Love
system.
me.
She is retired now, and so I do travel with my job, and so when I'm traveling, she is my nanny while
Okay.
I am gone.
And he does well with his grandmother.
Yes. Mm-hmm.
Blessing. All right. Let's bring up our comments, Al. Let's look at our comments. Leroy Barnes, Queens, outstanding, important discussion. I agree, my king. I do. Yes. Traveling all over to Egypt. In Florida, trying to get diagnosed is a 3-year waiting list.
Mm-hmm.
Academically, my 16-year-old teen is an A and B student homeschool program that is the best in Florida. 3-year waiting list.
What
Wow.
part of Florida is she in? Do you
What part of Florida, Miss D?
While Mama's D is writing, I remember one of the, oftentimes with just children in general, but even with children that are autistic, with their like when you touch them or them touching you, it's
know?
like no, they're not gonna do that. But
Right.
I do remember one of the last times I was at their apartment. I think it was in Huntsville, and I woke up and Aiden was laying right next to me.
Mm-hmm. Mm-hmm.
I
Yep.
felt really honored because I was like, kids know good people. That's what I felt like. But for Aiden though, like I woke up and he was right there, like unbothered. I don't know if he was like, well, she in my space, so I'm looking at her. I'm not really sure what it was, but that's my little homie. Like, and he's such and I tell you this, and I try to tell you this all the time. He is such an amazing kid. I feel like he is literally like one of our bright spots in our lives. And watching you go through everything that you've gone through from, losing Ari and then gaining Aiden and just like it's almost like you had a 1-2 punch, but the way you have really poured into him, I try to tell you as much as I can, like you really are an amazing mom. Like you
Right.
really are. And the crazy part is you thought for a while that, you were like, I'm not a mom anymore, or I'll never be a mom. And then whoop, what do you know?
Yeah.
What do you know? You know what I'm saying? And like,
Yeah.
just really watching you guys grow to get like Aiden is your child. Like he is your child through and through. But I can also tell like when he's focused and when he like you can just look at him. And I have a picture of
Mm-hmm.
my phone of him when we were in Target and he just has his big eyes, he was
Mm-hmm.
laying down and I was like, he's thinking of a master plan. But you do that. You do that, Danielle. You're always thinking of your next move. Like you're always, and he gets that honestly from you. And I do believe like your voice on this and your attention to detail, just in life, in period, but especially with Aiden, to so many black moms are confused. They don't even know what to do when
Right.
it comes to when their child is just comes out special. And like you mentioned earlier, the first thing they tell you, ain't nothing wrong with that baby. Just pray for him. Blah, blah, blah. No, here's the thing. It could easily be something else. I'm gonna pray for my child. I'm all those things, but I'm also gonna get my child the right care. What we're not gonna do is stifle him or her from getting the care that they need.
I agree.
And
I
I think
agree.
that that's really important. And you've been able to manage that. What has been the hardest thing for you?
I would say the hardest thing is when you have a child with special needs. The hardest thing is just trusting people. Like even when I take him to school, like just trusting leaving your child, especially like I have a child and he doesn't talk. So it's like he's not going, he can't tell me if somebody does anything to him. So I think that's one of the things, like just really trusting people to do right by your child, because I mean you hear so many things, and I've worked in education. There are amazing educators, and things, but sometimes kids, especially our black boys, fall through the cracks. So I think just trusting that when you send them off, that everything is going to be done. And so I think that's why I am so, like you say, just meticulous, and I'm just on it, and I make sure, and I'm checking, and and I'm calling, and I'm making sure that you do exactly what you're supposed to do for my baby, because he's not you're not gonna let him fall through the cracks.
Good fact.
You're
Does
gonna
Aiden have any of those bracelets or any of those things to even let people know that he's autistic? Like, does he?
so so we had a little incident where he got out. So they will, autistic kids, they'll wander off, and but he won't keep things on, so that's the
Mm.
issue with the bracelets. I did order them, but he won't like keep a bracelet on. But they do have things that you can actually order, and they put them in your shoe. You can actually, there are things where you can insert like even the AirPods in their shoe, and you can put them like in the soles of their shoes, because they do
Mhm.
just wonder, because they're just in their own world, like do. They're just going, just feeling the wind. And so he doesn't have a bracelet, but luckily when he did wander off, the police knew, they recognized that he was on the spectrum, so they knew.
Okay. Al, did Miss Dean put the city up? What's her city that she's in? I think it's Miami.
Central
Central
Florida.
Florida.
Central
Central
Florida.
Florida. Okay.
Mhm.
All righty. She is
She is
showing
showing.
all the signs, but she speaks very well and academically very well. She is ADHD and server depression.
Severe
Severe.
depression.
Sorry, severe. And very confusing. Very confusing.
Right.
Sometimes those waiting lists can be very long. I was lucky because the doctor who diagnosed Aiden, he does have a very long waiting list. So I was blessed that he did get in, but sometimes they can be long, and especially in our areas. And if you don't have, the financial resources, it can take a while. If you're going through a school district or things like that, sometimes the waiting list
It's
can
long.
take a while.
Um,
Mm.
Well, it's crazy how the hour went so fast.
I
It
know.
went really, really fast.
But
It
before we
did.
I want to get these last comments in.
Okay.
Dr. Carol said, thank you.
Mhm.
Support is so important. Yes, it is, Bonnie. Camille Scott, great topic. Hey, ladies. Hey, Camille. Kimmy G, I'm so late. Hello, everyone. Hi, Kimmy. Oh, okay. All righty.
Okay, well, before we wrap up, Danielle, I just would like for you to give whatever. I mean, you've given amazing insight, but whatever you feel on your heart to share with new moms, mothers that are going through it right now, and they're finding a difficult spot within getting their child help. Whatever it is that you feel that you want to share from your heart to them, I want to give you the opportunity to do that. So go ahead.
Amen.
Mm. I remember when I was sitting down with the doctor after when he was diagnosing Aiden, and I was asking him, I was like, well, we've been in the house because I've been teaching during the pandemic, and I haven't been paying him attention. And the doctor said, there's nothing that you did that caused this. And so it kind of, at the time, it didn't really hit me until later. And so I think a lot of times parents are trying to come to terms with why this is happening, like, why is this my child? And there's nothing that you did that caused this. And it took me a while for that to sink in. He was like, there's nothing that you did. And, this is just who he is. And that's just who they are. And it's nothing that you can change about that. You can get them the things that they need. You can get them therapies. And sometimes it's going to be a wait. And sometimes it's not going to always just come quickly, and you just got to get patience, and you just got to push through. But just know that it's nothing that you did, and I think sometimes we feel that guilt in thinking that
Mhm.
it's something that we did that caused it, and it's nothing that you did.
That's powerful. That's powerful. Well,
Well, I just want to say thank you for accepting the invitation to come on and spread
Oh,
your amazing knowledge and just, I mean, it's just real. It's just, you
real.
know, it's this is Autism Awareness Month, and you know, blue and all the things, and just making sure, like I said, between you and my best friend, I've learned so much over the last couple of years, and I have a different heart for children with autism, and I also have a different heart because, like, you know how oftentimes when you're like in the airport or at the grocery store and you're like, man, that
mm-hmm.
kid, why is that kid so bad? Or why that kid acting out? And you want to get annoyed and mad. But then now I notice that I step back like, it could be something else.
Something.
Mm-hmm.
It could be too much going on in the space that he's in. And low key, they might have should have left him at home or left him in the car.
Mm-hmm.
Well, you know what I'm saying? Like, and not brought him to the grocery store, not brought him to the mart, or even in the airport. Just having a different level of grace and understanding. Like, the kid, it's not like it's not always that's a bad kid. Like, it could be
Mm-hmm.
clearly something else. So just being mindful of that, even while I'm out and about, I really appreciate that. But I've appreciated, like I said, just watching you grow and glow. And I love Aiden, man. That's the little homie, and he's a really great, fantastic child. Like, for real,
Mm-hmm.
for real. And I think that you guys are a pair for real. So thank you for coming.
We
Thank you for having me. Thank you.
appreciate that. Listen, we are going to continue up. She also passed her driving and road test with flying colors. Thank you so much. It's helped me to think again that maybe she doesn't have
Right.
That's
Right.
right. My son was diagnosed at 6. I'm still a learning daily. I didn't know that, Kimmy. I did not know that. He's almost 16 now. Bless your heart. You go, my sister. You see people, you meet people, and thank you, Leroy. And you never know what they're going through. And Kimmy, you never, and all that I've been around you when we first met, you would have never told me. And looking at you, Danielle, you don't, we don't have to carry this weight alone. We need a village. That's one thing I want to say. Don't be afraid to ask for help, as Danielle stated. And then, like Micha always says, show yourself some grace. Be gracious to yourself. Well, listen, I appreciate you. When we see you in 2 weeks, we'll have another fantastic, phenomenal guest as we've done in the past and tonight with Miss Danielle. And we want to say to you, may God bless you. And ladies, what do we say together? Live to be
Yes, to be
well.
well.
Thank you. Good night, everyone.
Bye.